Welcome to the Flex Mettle Podcast, everybody. We're going to be talking about the knee and different exercises around the knee and what our favorite ones are, and have a little discussion back and forth on, our general thoughts on these different exercises and what we look for, the purpose of them. Hopefully give the listeners an idea that at least Christian and I, but hopefully all physical therapists, we're not just picking exercises out of thin air and randomly given to you at a random dosage amount. These are specific things that we have a purpose for. So my first point that I want to start out with, Christian, and I got several of them that we'll get into before we actually get into the exercises themselves. But point number one, I'm a firm believer that there's no such thing as a quote bad exercise. Only exercises that are poorly dosed or prescribed can be quote unquote bad. But I don't think there's such a thing as a bad exercise. We just don't give them the correct amount or the correct way. Your thoughts?
There are also many right answers. For any given thing that you have, there are so many different ways you can take it. And part of the job is just figuring out what that person needs then in that moment and then where to take it from there. But there really aren't bad choices. It's just, like you said, how do you put those different variables together to get a winning recipe? And so for exercise, we're thinking about your dose, which is like your sets, your reps, your weight, your frequency, your tempo, so how fast you're moving. And then a big one for us when thinking about your exercises is what have you been doing lately? What was the most recent exercise variation? And then what's the one we're going to? How big is that jump? If that jump is huge and those are very different exercises, that's probably not the best choice. And then like another major concept around the whole bad exercise topic is it's really important for us to match the intensity of the exercise with your irritability level. So what could be a great exercise for someone might just be introduced at the wrong time when they're way too flared up and they can't handle the stress of that exercise. So we need to figure out the best way to go about that for you.
Yeah, absolutely. Quick little story time. I had a patient about 3 weeks ago that I eval'd, 21-year-old female with just general anterior knee pain. And I gave her some knee exercises I thought were pretty basic. Not that bad. I thought it was a good starting point. She hasn't really exercised much before. She was a gymnast in high school, but then didn't work out or anything after that, which no judgment, but just her history. I gave her some pretty simple knee exercises to work on it. And she came back the next visit and it was like, my knee hurts so much worse now since doing those exercises. I'm like, well, damn. Sorry to hear that. Didn't anticipate that. This is what we're going to do. We modified, made them even easier. She came back the next visit, said my knee feels a lot better. Took one more visit after that. Within about 2 weeks, she's like, I have no more knee pain. I feel good to go. I'm like, perfect. Let's just stick with these progress exercises now, and you're good to go. And so that was a very quick time frame, but sometimes it works out like that, where we think it's going to work, and it doesn't, and you got to modify and make it work for the patient.
And that was a pretty straightforward case where it actually worked out with the one change you made.
Usually it doesn't.
It doesn't always like that, no.
I'm a wizard, dude.
It's the best around.
All right. So the next point, I believe that as long as we have good clinical reasoning, such as specificity, is this supposed to be for pain reduction, motor control, trying to improve different movement styles, strengthening, etc., we can rationalize almost anything. Kind of like to your point, Christian, what you said about there's many right answers. I think that's a generally agreed upon consensus.
Yeah, totally. Specificity is a tough one because the best way to think about exercise is how close are you able to get your exercise to the task at hand. That's called your specificity. But there's this weird thing that when you get way too specific, you get way too close to the real thing for too long, and that's the only thing that you do, so that's in place of all other options, you end up getting worse outcomes and you set yourself up for overuse injuries. And so you have to ride this line of being pretty specific, but also having some variation in the mix to help improve your performance, improve your long-term gains, and making sure that you have a steady rate of gains and also reduce that injury risk.
Absolutely. So going forward, if we're thinking about the knee, keep it specific to muscles here. There's a lot of muscles that cross the knee joint that aren't just the quadriceps and the hamstrings. So I don't know if that just blew some listeners' minds, but it's not just quads and hamstrings. So yes, we have the quadriceps and hamstrings. That's the main, those are kind of like the big hitters, right? But we also have some other muscles I want to go over that I don't think should be looked past when we think about knee health. We also have what's called your TFL in your hip. That turns into the IT band that connects to the lateral knee. We also have the sartorius, which kind of crosses the thigh from outside to in, connects to the inner knee. We also have the adductor longus and what's called the gracilis, which are two adductor muscles or muscles on the inside of the thigh that go from the pelvis down to the inside of the knee. And then lastly, coming up from beneath, from the calf, we have what's called your gastrocnemius or your gastroc that connects on the top part of the back knee. And we also have what's called your popliteus muscle, and that goes from the outside to the inside, going behind the knee. So you can see there's many muscle interactions around the knee. I know for me personally, Christian, I mainly focus on the big two, the quads and the hamstrings. Sometimes I'll focus on the gastroc and whatnot. But from your perspective, do you ever take into account these other muscles I listed off when it comes to treating knee pain?
Yeah, we all think about the quads and the hamstrings, of course, but I do actually think about the adductors a lot, especially for people that are in high velocity sports. So soccer, basketball, anything that involves cutting. And then as well as people that do very high range of motion back squats or front squats. As you get into that deep range of motion, you're going to use those adductors a lot. I like to make sure that people are pretty fit there. So that's where you're going to introduce movements like deep squats or side lunges. Those kinds of exercises do a great job there.
Perfect. Love it. All right, last point before we get into specific exercises. So muscles also work in different ways. There's different contractions that the muscles work in. So this might not be totally new for everybody, but we've heard of the concentric contraction. That's where the muscle shortens. We also have what's called an eccentric contraction where the muscle actively lengthens. We have an isometric contraction where the muscle stays in the same spot but is contracting. So muscles work in different ways in those different contractions. Lastly, we also have different muscle function based on if it's a closed chain or an open chain activity. So an example of those, closed chain is like when you're stepping up or doing a lunge or a squat, right? Your foot is planted on a firm surface, whereas open chain is like a knee extension machine or a hamstring curl, where the foot is not fixed and you're moving that lower leg based on the knee action.
The one thing I want to add here is going to be why it's important to load your muscles in different ways and use them with their different qualities. And that really goes back to what I said earlier about injury risk reduction. When you use your body in the exact same way, exact same stances, speed of movements, loads, movement selection, you increase your risk for injury, and having that variety helps distribute that work across different parts of your body and allows you to recover from that training stimulus. And so it's also the contraction style. So like Eric was saying, if you do some movements like eccentrically focused or concentrically focused or isometric, you're going to have more variety. That's generally better for you.
Absolutely. Yep. All right. So now with all of those, kind of the stage is set. Let's get into some more specific things. So favorite knee exercises. I got my 5 that I put down for different reasons, for different demographics and whatnot, different scenarios. Christian, did you just want to talk about these 5 or did you have some of your own favorites? Or did we have some overlap?
I like all of yours for sure, but I did add some more to your list.
Perfect. All right. So I think the first one that we can just generally agree that these are fantastic exercises for many reasons, but just simple knee extension, hamstring curls. Knee extension machine or a hamstring curl machine, they're fantastic. If you want to work the quads in many different ways, do a knee extension. If you want to work the hamstrings in different ways, do a hamstring curl. Great idea for things like anterior knee pain, right? So general anterior knee pain, lowering the quads, lowering the knees, hamstring strain, right? It's a safe way. You can do anything from no resistance at all the way to really heavy sets by doing hamstring curls and just general knee strengthening, especially like post-surgical. I think that it's a great exercise to utilize. Not to mention we can do very easy, safe, eccentric control or strong concentric, whatever it is. I think that this is probably the top dog when it comes to knee exercises.
Yeah, I think the most important machine any PT clinic should have after a squat rack and dumbbells and a bench is going to be a knee extension hamstring curl machine. Maybe a cable tower, but you can do without that thing. But
Yeah.
these exercises are just so important, like you said, for anterior knee pain, like runner's knee, for tendon pain that you have. They're critical. And I love this exercise so much. And even just for getting extra volume in, if you're trying to get a little bit of muscle and you're tired of doing squatting and lunging variations,
Yeah.
throwing in some quad extensions or hamstring curls at the very end, great way to get more muscle growth.
Hell yeah. Pull those shorts up a little bit. See that VM pop? It's been a long day for me. All right.
I know you're dying, dude.
I'm pure energy right now. I'm fading out. All right. This is the next one on my list is like sneaky one of my favorite ones behind the knee extension,
Yeah,
which is
100%.
Peterson squats. I love Peterson squats. I feel like if you can do a solid depth Peterson squat, you can conquer the world. Like
But
these
what
things are
solid
awesome.
depth? What high box? I would say the 16-inch box
I was gonna
is
go like
pretty
12.
badass. That's all right.
I mean,
Yeah.
six, if you can do 16, 18, that's like, yeah, you're right. That's badass. But like, if you could, I think like if I have a patient come in and we can get to like that 10, 12-inch box and they can do it for reps pretty easily, I'm like,
We're probably good.
problem solved. It's so functional. It's so functional, especially for patients like, um, we see a lot of like post-op total knees, and by the end of their rehab process, like I usually have them pretty decently doing some Peterson squats. Because like if you can do a Peterson squat after a total knee, you can walk up and down stairs no problem. And that's like that's one of the biggest, dysfunctions I guess after a total knee is that eccentric control down a step. And so I really like that. Again, anterior knee pain is great for stability and control, eccentrically lowering down on a Peterson squat. Yeah, it's music to our ears. It's a great exercise.
This exercise is top three for sure. I use it a lot with my runners. It's a great way to get you strong in a very specific way for running because you have that one-legged stance. It's making you work your hip in just the right way. So a common thing we'll see in a running gait analysis for people that have hip pain or foot pain is they might have what's called a hip drop, which is a sign of they have weak glutes in the sides of their hips. And the Peterson squat is exceptional at strengthening those glutes, not just strengthening, like Eric said, working on that coordination, improving your balance, and all that stuff makes you more resilient for running and also makes you much more efficient when you can better absorb the forces of running and then recycle them. Peterson squats are very helpful for that.
All right, going down the list. Next one, single leg Romanian deadlifts, single leg RDLs. I mean, if you want to learn how to pick something up off the ground, this is a great way to do it. Getting in a functional single leg stance hip hinge, it's
It's a little try
fantastic.
hard for picking something up off the ground.
Well, for the golfers out there, they know what we're talking about. You got to pick up that eagle putt out of the hole,
Yeah,
getting down there
okay,
in this.
fine,
Yeah,
sure. Yeah.
yeah.
Isn't that what your caddy's for?
I mean, you can look at them, tell them to pick it up. Yeah. But anyways, yeah. So no, single leg RDLs again, stability, single leg. You're on one leg, doing a pretty dynamic movement, especially if you add weight to the front of that. It can be a tough one. It's a great way to isolate those hamstrings, get them working in just a different way, right? They're eccentrically contracting on the way down so that you can perform that hip hinge and then pulling yourself back up. I really like to do the single leg RDL towards the end of a rehab session or a workout program. Once you really got those hamstrings fatigued out, and then you make them stabilize, you make them control in this hip hinge fashion. I really like the single leg RDL for that.
Yeah, I like the RDL for the same reasons I like the Peterson squat. It has exceptional carryover for runners or anyone that ends up spending some time on one leg. But the other reason I like it is for people that run really fast. So sprinters or anyone playing a sport that requires top speed, because a common injury with sprinting is going to be hamstring strains. And a big reason for that is there's a lot of force when you're sprinting, but also there's a lot of stretch on the muscle with that high force. And single leg RDLs can really help with getting you strong in that maximum stretch position to reduce your risk of hamstring strains. But not quite as good as your next exercise.
The next one, I might have put it too low on my list, honestly.
Well, these were ranked? Oh,
Yeah,
I thought
these
we
are
were
ranked
talking
for
about.
me.
Oh, all right.
So yeah, these are ranked for me. Yeah,
I don't agree with your rankings, but all
I
right.
know, I know. That's why I'm like, this one's probably too low. Now that I put it on here, but Nordic hamstring curls. I put in all caps. I said prevention. I'm not going to yell it, but you could yell the word prevention on this one. If we want to prevent hamstring strains, especially in high, powerful performing athletes like sprinters, soccer players, etc., being able to rep out some Nordic hamstring curls, fantastic exercise.
I think we talked about this on a past podcast where I don't actually know why it's so good. Was it or is it that doing a base Nordic hamstring curl requires quite a bit of strength already? Kind of like a pistol squat with body weight requires a
Yeah.
pretty good amount of strength just to be able to do on its own. Or is there some magic of it being purely or largely eccentric being the focus for this exercise? Is it the range of motion that you get through, or really is it probably all those things I'm sure are working in your favor to make this exercise so exceptional at reducing injury risk? And then also, I
Yeah.
think it just happened to be one that was studied pretty hard. Maybe others would have a pretty good result too, but this one gets a lot of hype in
A
our
lot of love.
industry.
Yep, absolutely. All right. And then lastly on my list, single leg calf raises. We talked about the gastroc cross and the knee. I like it. I like the single leg calf raises. I like it especially for my post-op patients. Not only are you strengthening the gastroc, but if you're doing a single leg calf raise, especially like a deficit off of a step, we don't really think about it, but in order for that knee to stay in the right position to perform it, you need some decent quad control on it. So a lot of times, like, post ACL patients that feel like they just can't control that knee, control that quad, make them stand on a single leg and then get them going up and down. That quad's working pretty hard to make that knee stay stable. So I think it's a good exercise, great exercise for the calf, for the gastroc and the Achilles, but also a good exercise when it comes to some knee stability.
Yeah, I love this exercise. It is so underrated, or at least under talked about, in just how much easier it makes your life without you realizing it. When you
Yeah.
have weak calves, life is just much harder. And then when you actually work on strengthening them, and you can do, I don't know, weighted single leg calf raises at a deficit with 20 plus pounds in your hands, life is just much better. Everything's so much easier. You feel lighter on your feet. Your feet feel better. Your knees feel better. You're more stable. I love this exercise. It's so good.
I
And who
imagine,
doesn't love good calves?
dude, it's all about the calves.
And it's so easy to work into your program too. Like you can put it with superset with anything you want.
So easy.
And
Yeah,
it's
so
so
easy.
easy to do. It's
Yeah.
just, yeah, it's great. It's like adding a bicep curl. Just easy
Yeah.
to do. Works great.
Looks good.
It looks
Uh,
good too.
I imagine just Christian, after you hit the gym, you do some solid single leg calf raises. You're just walking out like it's gonna be a good day,
There's going to be a little bounce in my step.
man. I forgot one. I Here's a little caveat. Here is the runner up on the list. One that is not probably thought of as a strengthening exercise a whole lot because we use it as an indication whether how well your quads are functioning. But a straight leg raise, supine straight leg raise, it's a great way to work the quads without having to go through a whole lot of quad range of motion. Should be no range of motion actually. And especially post-op for patients. Like once they have that straight leg raise intact and ready to go, add a band or a weight to that and just start repping those out. By the time you do 3 or 4 sets of those, your quads, it's feeling it.
Yeah, this one's just good for anyone to know. After a knee injury, no matter what it is, you're probably going to be doing this exercise. And it's so helpful early on after you initially had an injury. So like Eric right now, after your lateral meniscus tear, you're probably doing those because they're going to feel good. They're going to keep your quad going a little bit before you can do harder stuff like deeper squats and your favorite Peterson squats.
Dude, but I swear though, okay, so I'm going to make this podcast about me. When I first hurt my knee, I couldn't do a straight leg raise to save my life because it hurt so goddamn much.
Wow.
I swear to God. That's
That's
why
impressive. Yeah.
when it first happened, I was like, my summer is screwed. I can't, like, my knee is not functioning whatsoever. I need to get imaging. I need to get surgery, blah, blah, blah. But took a couple of days, did some good rehab to it, got the initial acute inflammation to get managed and pain under control, and then started being able to do some straight leg raises. And now we're just repping them out, and I love it. It's great.
Dude, they're so good.
So good. So good. Anyways.
Great for your hip too, by the way. They feel
Yeah.
really good on your hip.
Yeah, exactly. Yeah. So
That's a different podcast though. So
yeah, we'll do
I
a different
had
one.
a few additions to your list.
Yeah.
My favorite, probably top of my list, no matter what, is going to be doing deep, heavy squats. Just
Love
ass to grass as far as you can get down. And not just going deep, but sitting deep with weight. So part of my getting warmed up before a squat session is just sitting in the bottom of a back squat with, 135 my back and just kind of stretching out. Feels great.
Yeah.
And it really does help with, I know it's not your knee, but going to your hip and improving your hip mobility.
Yeah.
It's a great adductor stretch. It helps just increase that overall comfort of those deeper positions.
Exactly.
And then I also like the knee resilience it builds, just getting wicked strong knees in full range of motion. It's never a bad idea to do that.
No. No, and I just want to point out that Christian's being modest. He said 135 on his back. We all know you got 315 on that bar. Yeah. We all know that you're not messing around with 135.
Just to get started, of course.
Yeah, of course. No, I love it. I like the deep squat. It's great. It makes it, at least just for me, it makes me feel good when I get into a nice deep squat and then you come out of that and it's like, oh, The range of motion is there. The flexibility is there. We're doing this great exercise. But for patients too, a lot of people only like whenever they think of a squat, it's like they get to 90 and back up, right? And if it's strengthening post op, after knee pain, hip pain, whatever it is, and you get them going into a nice deep squat like that and they come back out of it, it's kind of a confidence builder, I think. Like, dang, my body is way more capable of things that I didn't know about. So, talking about that resilience piece, yeah, I think deep squats are a great exercise.
Yeah. I think most PTs know that and they try to get their clients training as deep as possible. And I'm sure most trainers feel the same way. But for people that are averse to it, definitely work into it. I think it's the most important thing you could do for strengthening your legs. If I had to pick
And
one
it's
thing.
safe.
And it's safe. And
Safe
it
to
makes your
do.
legs look good. There's that.
I
The
love
next
that we're
one,
focusing so much on the legs looking good. They don't get enough love. I'm telling you.
the next one's going to be clamshell. A lot of hate on this one,
I'm
especially in
excited
the
to hear your
rehab
position.
industry.
I'm
Dude,
excited to hear your position on this.
look, if you want your bicep to feel better, you're not going to only do lat pull downs or pull ups or rows. If you want your hip to feel better, you're not only going to deadlift and squat. You're going to do your bicep curls for the arm. You're going to do your clamshells or your bridges or your kickbacks for the butt. And it's going to make that area feel a lot better. It's just a great exercise. And of course, we get people out of hip surgery. You're a young athlete, you get your labrum repaired. You're older, you get hip replacement. Whatever it is, doing clamshells or doing your straight leg raises, they're part of any early post-injury plan. And
Absolutely.
they have a place, they for sure have a place. And even later on, if you want to get a little extra for your hip, just because it feels good, throw it in as it's great to superset, just like calf raises.
It's easy to do. Exactly.
Yep, easy to do.
No, I like clamshells too. It's not, again, there's no bad exercise. And I know this one gets a lot of hate. And I don't know why it got a lot of hate. And I'm like, I wonder if it's just like the rehab industry, like we were looking at like trying to rebrand ourselves or something at some point, and we saw people lying on their sides, lifting up their knee. And they're just like, that looks so lazy.
It's so lame.
It's
Yeah,
so
I know.
lame. We have to make fun of it and tear it down so we look so much better as a rehab industry, as PTs. And so we just shot it to shit. And it's like, why are we knocking this? It isn't bad. It's a good, solid exercise to do.
Totally, 100%. One that I like, maybe more than a Peterson squat. Maybe not. Peterson squat's so good, but is a high box step up.
Yeah,
High box meaning knee height or a little bit higher. So I think I like it so much because you're pretty much starting in almost an ass to grass squat,
you're like a deep
which
squat. Yeah,
is just the best. And so doing high box step ups gets that. And especially when you don't use your back foot to push off and you get all that front leg drive, it feels great on your high hamstring, your groin, and then of course your glutes for sure will get a pretty good stimulus from it.
absolutely. No, it's great. And you're working deep range of motion, right? Muscles don't just function in 0 to 120. Like we need to work the range of motion of these things more than what we just do daily, right? If you can do the extremes, and then you're going to be able to handle what you need on a day-to-day basis.
Yeah, going to those extremes builds you a buffer of resilience. And that's a major tenet of injury prevention is how big are your buffers? The bigger they are, the better they are, the better you're going to be. Another one I like a lot for the front of the knee is going to be a Bulgarian split squat. So these ones, man, it's kind of like to me, it's kind of like when you get on a good spin bike and your knees just get really warm, they feel great right in the front. Bulgarian split squats, because there's no impact to them, you just get that nice like front of the knee pump kind of
Yeah,
feel. It just feels you feel really warm and good. It's great.
it feels get a nice warm chest. Your heart grows 3 sizes.
Dude,
You know.
that's true. They are basically cardio.
Yeah, yeah. There's
Nothing
some
is more
truth to that.
humbling. Nothing's more humbling than when you put Bulgarians in your program for the first time in 6 months, and you go to figure out what dumbbells to use, and you overshoot every single time.
Yeah,
Like
yeah,
there's no way you can handle what you think you can handle.
yeah. No, I like the Bulgarian. I do. It's a sneaky one. I think we forget about it, and it's a good one not to forget about.
Yeah, it's also good to modify for folks with a lot of pain in their knees. So if they have a lot of pain in the front of their knee from runner's knee or a tendon issue, and you want to pull some of that pain back, you can just shift their knee position with this one really easily. So being more forward, knees over your toes, more knee stress, pulling that knee back, like getting more into the hip, less knee stress. And you can use this exercise for many different rehab goals.
Yep,
Now, the
100%.
last one on my list that I use a lot for folks is going to be the pistol squat to a box. This one is I like to think of it as a way to train the deeper range of motion in a Peterson squat before the person is ready to do a full range of motion Peterson squat, because they get a chance to fall on their butt onto the chair or their bed or a couch, but they're still getting all the benefits of controlling that movement all the way down to that surface. And so you build a ton of control and strength of your whole leg.
Yeah. Yeah. Another good one for post op too, I think, especially for people that like, they're having trouble early on. They get to a bottom of a squat and then they try and come up and they kind of shift their weight or they compensate to try and get up to the top again. But like, it's good. I think it's a great one just to focus on that eccentric control down to a chair.
Yeah, if I had to pick one out of all these, I'm definitely going to stick with the deep squats.
Yeah. Yeah.
Hands
Yeah. I would
down, favorite
agree.
exercise. Personal favorite too. It's my favorite movement of all
Yeah.
for my own training. Yeah.
If I can, I'm gonna agree, but I'm gonna throw a different placement of the barbell. A deep squat, but a front squat. So throwing that barbell on the front, getting deep.
Oh, God.
God, dude, you get down with that. Like I own this place.
You
This is
do. You do.
this
Yeah,
is
I'm training
my
front
squat
squats
right
right
now.
now, and yeah, I'm doing heavy fives and front squats right now, and yeah, they're pretty humbling.
Dude, they talk about cardio, dude. You do some heavy front squats for 4 sets, 5 sets. You get done with that.
I still, to this day, feel those the most in my upper back. That they just make
Yeah.
your upper back feel so good.
It's a good core. It's good core strengthening all the way from the
Great
back
core.
to the front to the sides.
Because no one has time to do abs. It's all just squat for your core or deadlift.
It is. Or throw a heavy kettlebell and do a Peterson squat.
I think that's it for me for the leg movements, though.
Yeah. No, I like the list, man. And obviously these lists could be not never ending, but like could go on and on and on about these things. They're all good to do and they're all great. And I think that they're good reminders of all the different exercises out there. And this is just a select few that we really like. But there's many, many different exercises out there to really work things, which is great. We want redundancy in our programs. We want to be able to choose different things that's going to be right for the right person. If we only had 3 exercises, there'd be probably a lot of people that we couldn't get better because not every exercise is going to work for the same person with the same diagnosis.
Yeah. We'll also do other things with these exercises too. So if you want to make these a little bit more, fun for some younger kids or little more balance aspects to them, you can do them on softer surfaces. So you can do your single leg Romanian deadlifts on a foam pad or a Bosu ball. Now you're training a little bit more neuromuscular function, which does have its role in injury prevention. So we can have a ton of fun with these, different ways to load, however you want to program them in. You can do so many different things with the placement of your feet, tempos, what implements you use. It's just, yeah, sky's the limit.
Yeah, a lot of modifications we can do. A lot of modifications. But anyways, so hope you all enjoyed that one. That's probably the shortest we've done a podcast since September. That's crazy. So anyways, yeah, no, thanks guys for listening. And honestly, I thought that was a great list. And if you have other ones that you love, shoot them our way. We'd love to talk about it, discuss them. Yeah, we'll take it from there. But any last minute thoughts or closing remarks from you, Christian?
Nope, all good.
Awesome. All right, everyone. Well, thanks again for listening, and we'll see you next time.